Hi, this video is the demonstration of the FUE donor scar, a few years follow-up. And again, we harvest the hair graft all throughout here, so there's tiny dots of scar here all throughout, and it's there. If you pay careful attention, it is there, but it's hard to see, and that's the great thing about FUE, allow you to wear your hair shorter. But the FUE is not just less visible scar, but less invasive, less bleeding, less chance of infection, less painful. But the downside of the FUE are it's more expensive. The number of grafts we can do is less. We do 25 to 3,000 grafts per day. Although there are days I can go beyond 25. I mean, I can go up to 4,000. Pretty rare. So the number of grafts we can harvest less. You can have good result with FUE and FUT, but the FUE, if you compare it to FUT, is slightly less. And again, I'm comparing my FUE to my FUT. It's around 5 to 10% of my FUE is growth less than percentage than the FUT, but you compare my FUE to other clinic that does FUT, my FUE is still better density. On the other hand, the FUT will leave you a linear scar permanent for the rest of your life. You can wear your hair short again. The FUT, not just permanent linear scar and you cannot wear your hair shorter. The other downside of the FUT are more invasive, more painful, more bleeding, more chance of infection. But the good part of the FUT is cheaper. You can move large number of grafts per day, 4,000 or 5,000 grafts per day. And the growth rate, you can have good result with FUE and FUT, but the growth rate at FUT is 5 to 10% better density than the FUE. So this is the demonstration of the FUE donor scar. Tiny dots of scar scattered throughout the back like a mosaic pattern, allow you to wear your hair shorter. And again, this is shaved with a clipper without guard, and you cannot see much of it. It is there, but it's hard to see.